Hi, Kathy.
Well, hello.
How are you? Thanks for
Hi.
letting us record. Today, we are taking out this front tooth. It's got an old big post in it, and the tooth's broken off at the gum line, so it's already kind of sticking out a little bit here. So I want to show how our process with implants is so different than everywhere else. But what we're going to do is we're going to take out this tooth today, and actually, why don't I show it on this x-ray? So this is the tooth. It's got that giant post inside of it, and the whole thing's fractured off of the gum line. So it's not fixable. And as we see, Kathy, this is in our first implant we've done together. We did these 3 over here back in 2014 or something like that. And then we did this other front one here. I don't remember when we did that one. But let's come around here. And do you mind if I show in your mouth? So bite down. So here is one of them that we did. And then this back area right here, these back from 2014. Look fantastic. You're doing a great job taking care of everything.
I follow everything you say.
So, well, thank you. So today we're going to take this out. We're going to put our implant in. And we're actually going to put a tooth on that implant today. So that way you don't have to walk around with a missing front tooth. Like almost everywhere else, they do that way. They make it so usually they take out the tooth, they'll put a bone graft in. Sometimes they put the implant in as well, but they don't put a tooth on it yet. They give you a retainer with the tooth that you have to wear. That covers your whole palate. That's very annoying. So you have to wait 4 months. If they do it where they don't put the implant in, they put just the bone graft in. We have to wait 4 months to let that bone graft heal, and then they put in the implant. And then wait another 4 months. This whole time you're wearing that retainer with the tooth. And then after that heals, then they can make a tooth for it. The way we do it is I'll take out the tooth, implant goes in, I'll bone graft along with it, and then I'll make it, as long as I got good hold, and 98% of the time we do, I'll put a temporary on today. It's gonna be a little shorter so you're not biting on it while it heals. And after 4 months, we can make our final tooth, that you can use like all of the other ones. But the key is, during that 4 months, you're not left with a gap or that silly retainer with the tooth.
Right.
So, ready to get to it?
I am.
Okay. So how has your experience been in the past too?
It's been wonderful. You saved my life.
No, get out of here. All right. So Kathy, how was it?
It was great. Thank you so much. No pain. You made sure you kept asking. It was fantastic.
Fantastic. So it took
Yeah.
about 40 minutes to get it all done, for the tooth come out, implant go in. Here is our implants. Got a big strong one in. This is our abutment. And we got the temporary on. This is the key part I didn't talk about earlier. Is we want to put the abutment on the same time as the implant, rather than doing it in multiple phases like we talked about before. Because we want this bone and the tissue that heals around this junction to not be disturbed. So we want to put it in and let it heal so it's pristine. If we did it in 2 steps, like a lot of other places do, that comes off later, and then they reintroduce, when they put it in, they introduce bacteria in there.
Right.
So you start off with a deep pocket that's hard to clean out of the gate. So if we put it in together, that all heals pristine, and we'll have like a 2-3 millimeter pocket, which is the ideal length like for a normal tooth, starting out of the gate. So here, let's show you the temporary too. Thanks for letting us show this too. So here's the temporary. So this is what she's going to wear for the 4 months. The gums up there are a little red still. That'll heal up in the next week or so. But you got to remember to not chew on it for the whole 4 months.
Okay.
So it's basically, if you're going to chew with anything, it's not in your bite. But if you could put, like, you don't want to eat a sandwich right
No.
now while it's healing.
I don't
of course.
eat sandwiches.
Yeah, there you
I
go.
don't like sandwiches.
So anything like that, you want to cut it up and just throw it to your back teeth while this is healing. So in 4 months, we'll take our impression for the final crown, and then you can use that like any other teeth.
Oh, okay.
So-
Yeah, you did 2 for me before. They're perfect.
Yeah.
They've done great.
I've actually done 4 for you
Yeah.
before.
Oh, before.
So all right, great job. Thanks, Kathy.
Okay.